In this video, I show you and describe what I pack in my individual first aid kit or bleeding control kit. This should give you an idea of how to pack your trauma kit and what items of first aid equipment you should consider packing. I take this bag out to the range, out on the hill, in the car and wherever I go. It won't do you any good if you don't have it on you. So the kit itself, I've got a Jackal Medical rubber bleeding control patch. This is ideal for your med kit. It clearly shows you and others where your vital trauma kit is located. So the pack itself, this is a Vanquest Fat Pack 5x8 Gen 2. Fat Pack is first aid trauma pack. The Fat Pack gives you instant access to all your life-saving contents with one downward pull. Let's just talk about the features of the pack itself. So you've got on each side 2 external elastic holders for securing tourniquets and shears for instant access. Sturdy grab handle, and that unzips 2 YKK zippers with a hook and loop fastener at the top. On the front, you've got a low profile MOLLE air structure. This can be used as a loop ID panel for blood type or other patches. On the back, there's a MOLLE back panel to let you attach the Fat Pack using MOLLE Sticks. So the kit itself, one downward pull, and that exposes all your equipment. Great thing about the Fat Pack is you've got lots of means of securing your equipment within there so that it's always going to stay in one place. So what have I got in my kit? 1 Shear trauma shears. These are used by military medics and civilian medical professionals to quickly remove clothing from a person in order to expose the wound and administer first aid. They're 7.5 inches long and they easily fit in most 511 or EMS style trousers. They're extreme heavy duty steel, nice thick blades. They've got razor sharp diamond coated edge. There's an oxygen key actually within the handle, which is great. You've got a blunt tip for easy access to tough to cut areas without harming the patient. They're easy to clean, easy to adjust tightness using a flat head in there. They've got a textured feel and they're non-slip. Next item, it's a Persis Medical Israeli bandage. This is the 4-inch emergency bandage. The Israeli bandage is a multifunctional hemorrhage control solution, which is a non-pneumatic trauma bandage. When you open up the bandage itself, there's a sleeve for self-application. It's got a multifunctional bandage for various wounds. It's compact, lightweight, waterproof, and it's all in vacuum sealed packaging, so it's sterile. And the great thing about these is they've got an 8-year shelf life. So within the bandage itself, it's got an integrated pressure bar to exert immediate and direct pressure to the wound that can apply 30 to 40 pounds of pressure. It's got a built-in closure bar, so there's no pins, no clips, no tape, no hook and loop, no knots. It's just easy. It's a non-sticky pad, so that eliminates any pain during removal and prevents the wound from reopening. Next item is the Prestige Tactical Fox Seal Chest Seal. So this is an occlusive dressing for the treatment of open chest wound injuries up to 15 centimetres. It's designed for simple, consistent performance in the field as a tool for prevention and treatment of pneumothorax. The adhesive works on wet and hairy skin. It's compact in size to fit neatly in the individual first aid kits, so that leaks from creased dressings that are stored folded are no longer an issue. Great thing about these is there's 2 seals per pack, so that allows for both entry and exit wounds to be treated, and the design is valve free. The chest can be vented with the easily gripped tab and adhesive reseals. Celox Rapid hemostatic Z-fold gauze. Time is critical when treating severe injuries in the field, and saving time increases the chance of survival for the casualty in an emergency or hostile situation. To be effective, hemostats need to work fast. Celox Rapid does just that. It removes the delay by speeding up the wound packing time and also reducing the compression time to just 60 seconds. This is going to save valuable time in an emergency, as well as reducing blood loss. Celox Rapid maintains its volume and adhesion to wet tissue during use, helping it stay in place during patient transport. Recon Medical Tourniquet. This is the Gen 3. Hemorrhaging is the leading cause of preventable death in tactical and non-tactical trauma situations. Research has shown that the fast application of a tourniquet is 100% effective in quickly stopping arterial blood flow in the shortest application of time, saving life and limb. Let's look at some of the features of this tourniquet. So there's a red tab to easily identify the end, a finger hole designed for better grip in the mud, blood or wet weather. It's a simple design for one-handed or self-application. The windlass quickly adjusts pressure in case the bleeding restarts. You've got a timestamp there, and then again, that is for writing the time of application using your Sharpie that you have within your med kit. That's what the Sharpie's for. And it's got a composite buckle on the back that resists breaking and cracking in cold weather, and it's CE certified. Great thing about these, they're a good size, so they're going to fit around most people's limbs. Not exactly bleeding control, but great to have. These are Hot Hands hand warmers. So they're an air activated heat pack that provide 10 hours of continuous warmth to your hands. In extreme cold conditions, there can be the risk of hypothermia amongst other people within your group or yourself. So if anybody starts suffering from this, hand warmers can help. You can wrap a heat pad in a sock or a glove and put this in the armpit of someone needing help. Again, you just need to open the sachet by hand, and exposure to the air will start the warming action. So great thing to have within your kit. A whistle. May sound nice and simple, but these are brilliant for attracting attention, and the sound of a whistle will carry a lot further than your voice. It's got non-powdered disposable medical gloves. So these are personal protective equipment to protect you and the patient from the spread of infection when your hands may touch someone else's bodily fluids like blood, secretions, vomit, etc. So great thing to have within your pack. The only other thing I've got in there is team medic casualty drills. You don't want to be reading these at the time of the incident, so training is the biggest bit of advice I can give you about all of this kit. Make sure you know how to use your equipment properly. You don't want to be reading the instructions when you're trying to apply first aid. There's no substitute for proper first aid and medical training. Jackal Medical, who supply these kits, so you can buy ready-made kits from Jackal. They also do a field care course, so that's a one-day course, and it covers all the essentials that you need for sport shooting at ranges or on open land. The sort of things it covers are about managing airways, gunshot wounds, catastrophic blood loss, breaks and sprains. So go check them out. I'll just lay out a bit of the equipment just so you can see them all. So thank you very much for watching, and I hope you found that interesting. Don't forget to like, comment and subscribe.